The number of female physicians entering the workforce is growing. Today, women represent 50% of medical students. Yet they report less control over their day-to-day work, lower compensation, greater strain in the work-home integration, and are more likely to report burnout than their male colleagues. Through an 18-month grant sponsored by the Physicians Foundation, the AHA and 5 other major medical organizations teamed up to help improve organizational structures and build individual skills of female physicians through the Women's Wellness Through Equity and Leadership, or WEL project. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. At the beginning of the WEL program, we interviewed 3 physician leaders. Today, now that the program is concluded, we're catching up with these women physician leaders to hear about their lessons learned and advice for others looking to do this work.
Welcome to another podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespaguachaga, Vice President of the AHA's Physician Alliance, and today we'll be talking to 3 physician women leaders who last year completed the Women's Wellness Through Equity and Leadership project. I'm joined today by Dr. Dawn Sears, Chief of GI at Baylor Scott & White. To get us started, Dr. Sears, tell me a little bit about yourself and your role at Baylor Scott & White.
Absolutely. First, I want to start by saying thank you for having us. Thank you for highlighting this program and the way it's going to continue to positively affect the world. But my role at Baylor Scott & White Health is that I am the Division Director for gastroenterology. That is an unusual place for a female physician. There are only about 10% of the division directors in gastroenterology are female, and only 30% of gastroenterologists are female. So that in and of itself, just me being present and being there is something that is able to help people see what is possible. As a result, we're able to increase recruitment of females to gastroenterology and to leadership. So my other major passion at Baylor Scott & White has been to start a leadership training program where it became obvious to me that so many women were seeing me in multiple leadership positions, and the medical students, the residents, the fellows, and my colleagues were coming to me saying, what's the roadmap? How did you get here? Who do I need to talk to? What courses do I need to take? And how can you help me? And obviously there was no roadmap. There was no 3 courses you need to take or a magical person who was going to open all the doors. So at that point, I decided to go ahead and write a program and recruit many of my friends. And we put together a program where we were able to empower women physicians and give them the resources to move up in leadership, and also empower them that they already had a lot of the groundwork there. They just didn't see it, and that the imposter syndrome that women feel is real and is holding them back. And we needed to open up the doors of possibility for them.
So can you talk a little bit about how you took this project that you were sort of thinking about and how you, through the program, really amplified it? Mm-hmm. And then especially would love to hear the lessons you learned that you applied in light of what we've been through over the last year with COVID.
When I came to the WEL program, we were asked to come up with our main goal, our indelible mark, how we wanted to impact our world for better. And mine was to put together this program to make a handbook so that I could deliver it to any institution, whether it's academic, whether it's private practice, whether it's a hospital system, whether you're a small clinic or a large mega multi-specialty institution, to be able to empower women with this same program and reproduce it. So literally putting together the program, talking about it with all the WEL cohorts and fine-tuning what I wanted to communicate. My flight home from Chicago, I wrote the program and then submitted it to my team the next day, and we tweaked it. And over the next 6 months, we got it into print, and now we're starting to disseminate it. So the reality and the space and the mental time of the WEL program allowed me to have an actual product within 6 months. So that was phenomenal. And that's one of the things that we greatly miss right now in the COVID era is we don't have the travel, we don't have the getting together in a single room to hash out these details, and we don't have that mental space to get things done. Right now, we are in the middle of a marathon, and we are all just doing the best we can. We are drowning in COVID. We're drowning in COVID policies. We're drowning in just the urgency. Every day is filled with at least 5 urgent issues that were a dream a year ago. I would have never thought that I would be discussing the nuances of antibody testing versus NNA and whether it's an outside institution and was done at a premier care center before I do an aerosolizing procedure on a patient. But I have to answer all of these things between doing projects. So right now, coming up with that mental space and energy, I'm able to use the WEL cohort and all those connections to just call my new connections and my new colleagues and my new advocates and partners just to brainstorm, just to give space for, hey, I'm dealing with this issue. How are you dealing with it? What do you think about this? What do you think about that? Meanwhile, the tools that I gained through the WEL cohort, including speaking with the media, communication strategies, negotiations, advocacy, again, networking and knowing that there are allies everywhere. You just need to ask. You just need to look. You just need to let people know what you need because no one's reading anybody's mind and everybody is doing the best they can. And I just chant that to myself all day long. You feel like the world's against you, but then you step back and say, no, everybody's doing the best they can. The people in research are doing the best they can. EVS is doing the best they can. Nursing is doing the best they can. Pharmacy is doing the best they can. And giving each other grace to know that we're all still in the storm, but nobody's out to hurt each other or be roadblocks, and that if you let them know what your specific need is, usually you can come up with a solution. So that's been a big part of what I've learned and how I have instituted that as we continue to survive day to day and week to week.
Absolutely. I think it's especially timely now to really be giving each other that grace and space to say they're coming from a place of positive intent. I think that's a really good lesson.
Absolutely. Absolutely.
So what advice would you share for others? You've talked a little bit about really using your network and some of the skills that you learned. For those who are thinking about this, who are thinking, I need more learning and training and understanding around wellness, around equity, around leadership, what's some of the advice you'd give to someone who wanted to get started?
Wellness, equity, and leadership, they intertwine so much, but they're also so diverse. So really defining what is your end goal? What are you trying to accomplish? I was speaking with a female GI leader just this week in another state, and she was saying, well, I need some executive training. I said, wait, hold on. What's your goal? What do you want to accomplish? Do you want to be the CEO? Do you want to run your own practice? Do you want to just have a better understanding? And so I think that unfortunately, we continue to want to add initials behind our name because we're so good at that as physicians. We know that there's a roadmap. You do medical school, you do residency, you do fellowship, and then you look around and say, well, what do I do next? Well, I should get my MHA. I should get my MBA. Well, not necessarily. Sometimes we just need to go to negotiation skills courses. Sometimes we just need to go to some advocacy courses. Sometimes if equity is what you want, then we need to get in those pockets with those conversations. And with those conversations, it's a lot of listening, and that's something we do all day long as physicians, but as leaders and as people who are continuing to educate ourselves, we don't always listen very much. And that was a large part of the equity conversations that we were able to have at WEL for those of us that are not necessarily in underrepresented groups. we were able to do a lot of listening. And who knew that in the next 2 years we were going to have so many discussions about disparities and about race and racism. And now dealing with so many of our female physicians who have had COVID and have died from COVID and are sharing their stories on social media, we are able to amplify those stories in a different way than we would have prior to the WEL course, because we have a deeper understanding, because we took the time to really hear each other and hear the differences of experiences, and that these are real, and this is resulting in people dying and our colleagues dying and our precious brothers and sisters dying, because their experience in the healthcare world is different, and they are not being heard, and they are not getting the care that they need. And then when we're looking at the issues of inequities of healthcare and the inequities of having an internet and computer for homeschooling, and realizing that these things that we just take for granted, that if I have to call in sick, I'll figure it out, that not everyone has those things. And we're putting our hospital systems at jeopardy when we have some of our lower paid employees are in some of these groups, and they feel forced to go back to work because we don't have a system in place in this country to make up for that loss of paycheck, loss of employment, and they may be coming to work sick, and they may be infecting people. So the terrifying reality that the systematic issues that we have are going to affect our patients and our systems if we don't address these things and continue to have these hard discussions is real. Meanwhile, for women that are interested in pursuing these things, there are so many Facebook groups, there are so many interest groups, there are so many areas of physician women empowerment and education, that asking your mentors for advice, once you have your goal in mind, they can help you customize your roadmap. There is not one size fits all for a female physician wanting to pursue leadership. So honestly, we're all making this up as we go, and it can lead to beautiful, wonderful, unexpected places.
I love the idea. Start with end goal in mind and then really, tap into all of those around you. I think that's a really rich way to think about it. Well, thank you so much, Dr. Sears, for joining us today and for your insights. Very much appreciate it.
Thank you so much for the time, and thank you for amplifying us getting together and the power of a collective force of a common goal. Thank you.